Let's meet Emily. She is a successful entrepreneur who has multiple restaurant franchises in Brunei. She thought of growing her business label internationally. She was skeptical at first, but with the support of her family and friends, she finally made a decision to pursue her dream of expanding her business overseas. In order to take her brand global, she spent several years of traveling across the world to not only find a perfect spot to build her restaurant, but also to gain inspirations to improve her menu. However, once the plane takes off, she starts to feel dizzy and becomes nauseous. This condition is known as motion sickness, or simply speaking, travel sickness.
Hi, I'm Emily. I really enjoy traveling to various places, but I tend to feel sick when traveling by air and even on train rides. Can you relate with my experiences?
Are you looking for a solution for travel sickness? Don't worry, because you're watching the right video.
Hi, I'm Nur Amalina, a fourth-year student from the Bachelor of Health Science and Pharmacy program in University Brunei Darussalam. Welcome to this video on treatment for travel sickness with Cinnarizine and Dimenhydrinate. First of all, what happens in motion sickness? In motion sickness, your brain receives mixed signals from your eyes and your inner ears.
For example, say you're in a flying airplane reading a book. Your brain receives signals from different parts of your body. Your inner ear sense movement, but your eyes tell you that your surrounding is not moving. These mixed signals can actually make you unwell.
Who are most likely to be affected by motion sickness? Motion sickness is very common.
About 1 in 3 people are at risk of experiencing motion sickness. This condition tends to affect women more than men, especially during menstruation or pregnancy. It begins in children at the age of 6 years old, and they become more susceptible at 9 years old. The incidence of motion sickness is said to reduce with age. Motion sickness is caused by repeated movements when traveling, such as when experiencing a turbulence during a flight, when going over bumps in the car, when moving up and down in a boat, when riding a train or a roller coaster in the amusement park. What are the symptoms of motion sickness? Some people with motion sickness may turn pale, experience nausea, vomiting, headache, drowsiness, and even cold sweat.
There are 2 medicines that can be taken to prevent and relieve motion sickness during any form of travel, either by air, sea, or road. These 2 medicines are Cinnarizine 25 mg and Dimenhydrinate 50 mg. These 2 medications require a prescription from a doctor. Cinnarizine 25 mg is a white and round tablet with the letter C on it. It is sold under the brand name Cinna. Dimenhydrinate is also white and round in shape with a score line in the middle. It makes it easier to break the tablet in half. It is sold under the brand name Novomin. For children between 5 to 11 years old, take only 1 tablet 2 hours before traveling. Then take half a tablet every 8 hours if it is necessary during a long journey. For children aged 12 years and above, including adults, take 2 tablets 2 hours before traveling. Then take 1 tablet every 8 hours if it is necessary during a long journey. The tablets may be sucked, chewed, crushed, or swallowed with water. Take Cinnarizine after meals to avoid stomach upset, and Cinnarizine can take up to 4 hours to produce its full effect. For children between 7 and 11 years old, take either half a tablet or 1 tablet. For children between 12 and 17 years old, take 1 tablet, whereas for adults aged 18 years and above, take either 1 or 2 tablets. Take this medicine by swallowing the tablet whole with water 30 minutes before traveling or as soon as you start to feel sick while traveling. You may take this medicine before or after meals. and this medicine may take up to 15 to 30 minutes to produce an effect. Especially for long journeys, you may repeat the dose every 6 to 8 hours when necessary. However, do not take more than 3 doses within 24 hours. Taking more than 3 doses within 24 hours may increase your chance of having side effects. For example, if your first dose is 1 tablet, then do not take more than 3 tablets within 24 hours. But is it safe to take these medications for a long time? Yes, it is, as long as it is taken according to the recommended dose.
Although uncommon, there could be side effects when the medicines are taken, such as drowsiness and dizziness, so do not drive or use any tools or machinery. If you experience dry mouth, try chewing sugar-free gum or candy. Or if you experience constipation, try eating food rich in fiber, such as fresh fruits and vegetables. However, there are cautions to be taken before taking these medicines. The medicines are not recommended in pregnant women and breastfeeding women. Those with eye problems such as glaucoma, stomach problems such as gastric ulcer or constipation, prostate problem, breathing problems such as asthma or emphysema, epilepsy, and cardiovascular diseases such as hypertension or cardiac arrhythmia. If you happen to be allergic to any motion sickness medicine, you might experience difficulty in breathing, coughing, skin reactions, or wheezing.
If you do experience any of these symptoms, you should seek an immediate medical treatment in the hospital.
Keep the medicines away from children, preferably in a cupboard, and store them in a cool place.
We have almost come to the end of this video, so now I will show you 3 statements that you can either agree or disagree by picking true or false as your answer. Are you ready? Let's go.
2 medicines that can be taken to relieve motion sickness when traveling are Cinnarizine 25 mg and Dimenhydrinate 50 mg.
The answer is true.
I still feel sick even after eating 3 doses of the motion sickness medicine in a day. I think I should take another dose.
The answer is false. Do not take more than 3 doses in a day, because you may develop more side effects from taking more.
My wife is pregnant, and she feels nauseous during our honeymoon on a cruise ship. I think I can recommend her to eat Cinnarizine tablets.
The answer is false. Cinnarizine is not recommended in pregnant women.
As most motion sickness medicines are not recommended for pregnant women, consider eating food or drinks containing ginger such as ginger biscuits or ginger tea to keep the symptoms at bay.
So did you manage to get any of the questions right? If you did, then give yourself a clap. I hope you have found this video helpful and informative. Just a disclaimer, the information mentioned in this video is meant to supplement and not substitute any medical advice. Please consult your doctor before taking any of the medications mentioned. Thank you for watching. Bye!